Well, the man himself, Dr. Taylor, is in our Worcester studio. Welcome to the Daily Politics, Dr. Taylor. Other than getting re-elected yourself, what possible hopes could you have for this election?
Other than getting re-elected myself, it is really to see a hung parliament, because I feel very strongly that if we had a hung parliament or even a coalition, then we could have a coalition of all the best brains to try and pull the country through what is a very dark patch and a very difficult recession. So, yes, I would like to see a hung parliament, and one would even have the dream of even an independent possibly even getting called in to help. And I would long to help on issues to do with the NHS.
Now that Kidderminster Hospital is safe, and that was the issue in which you originally fought this seat, is there any real purpose to your party?
Yes. We lost the main things that make a hospital in September 2000, before I became the MP. Since being the MP, we've got quite a lot of elective surgery back, and we've got a lot of investigations and a new MRI scanner coming. So we're doing well, but we have not got adequate emergency services. We have lost a midwife-led birth centre, for which there is no reason why we can't get that back. And we've recently had troubles with the out-of-hours care, which has been taken over by a new provider, and we desperately need to watch that and make sure we get better out-of-hours services. So there's still a lot to fight for. As
a doctor and as someone who's campaigned on health issues, which of the three manifestos of the main parties is most convincing on health?
The absolutely marvellous thing about being an independent is that you can pick and choose. And certainly, if I take the Lib Dems first, they have picked up the point we have discovered on the Health Committee, that the testing of European doctors is absolutely inadequate. And so one of their points is testing of all doctors, which is crucial. Another really important point is move to prevention, because in the long term, if you can shift money out of acute care into prevention, it will save money, but it's a very long-term thing. So I like those two things in the Lib Dem manifesto. Okay. Coming to the Labour one...
Actually, I'm afraid we're not going to have time to go through them all, Dr. Taylor. Just give it your best shot. Which of the three is marginally better in your view?
I'm afraid I've no doubt that the Labour manifesto is better. I'm much more on the side of them than the Tories for the NHS.
Thank you, Dr. Taylor, for joining us from Worcester. Now